I'm a guest on his show, but I guess he's also a guest on my show. I'm interviewing integrative health engineer Misha Sakharov, and this is in a series. It's part 5 in the series about the healing of cancer, medicine-free. That is, not using medicine, not using radiation, chemo, but using other methods to heal cancer, of which Misha has had good results so far. This is part 5, optimization of breathing, Buteyko method. But so the first thing I want to ask you, Misha, is why has the way we breathe got anything to do with fighting cancer? How can you link the two?
First, hello everybody. Thank you for joining. And well, breathing is one of the most vital processes in our body. We can live without food for a month or something. We can live without water, well, I don't know, for days or for a week. We can live well without sex for years.
Some do.
But without breathing, we would collapse. The most of us, we would collapse actually already after 20 seconds, 25 seconds. Yes, many of us will have a feeling of asphyxia, a feeling of lack of the air already after 10 seconds, 15 seconds, and then we will pass off, or we'll get the blackout.
Yeah. So
that's the most that's the process that we really cannot live without. So that's the first of the 5 physiological processes that is indispensable. Totally.
I see. For
a shorter period of time.
Mm-hmm.
Okay,
well, that's but how do the way we breathe now? Everybody is breathing. Otherwise, we'd be dead, as you say. We're all breathing, but as far as I understand, what you say, there is breathing, and there are correct ways of breathing and incorrect ways of breathing, which have a dramatic effect on our health. Can you please explain that?
Totally, you're perfectly right saying that, and maybe I would start from the start, saying that in our life, in our world, very high-tech Western world, the occurrence of cancer and of other lifestyle disease are taking a form of epidemic.
Proportions.
Massive. Massive. As you mentioned in our last session, the generation of our children, of my children, for example, they are about 20, 18, 23. The generation of my children, according to World Health Organization, will half of them will experience cancer in their life.
That's dreadful.
That's dreadful. And the same is about, people don't know about that, but actually the same is about Alzheimer's.
Oh, wow, that's incredible, because to a degree, Alzheimer's is a worse disease than cancer, especially to the relatives and the people close to people with Alzheimer's.
It's degenerating and debilitating and desocializing people, And if we start there, so we can say that why do we have all of this lifestyle disease?
Mm-hmm.
Mostly because of stress, and it's not acute stress I'm talking about.
Mm-hmm.
Impact of chronic stress. You see, all of them are impact of chronic stress. And stress is different things. It can be stress from pollution, environmental stress.
Mm-hmm.
It can be stress, by breathing the polluted air. It could be stress from the food, polluted with different kind of E numbers, different kind of additives, and simply food that is not good for human digestion, for human nutrition. The other thing is psychological stress, and that's the kind of stress that we most often talk about. The stress in the working place, the stress in the family, the stress because of financial situation, the stress about the future of the children, the stress about your own health, anything like that. It will make you go over from acute stress to chronic stress.
Okay. And this stress manifests itself, among other things, in the way we breathe.
That's right. And this stress manifests, among other things, in the way we breathe. So prolonged chronic stress of any kind, actually, all these three kinds, or maybe some other kinds, it will lead to what we call physiological habituation to over-breathing.
Over-breathing. Now, how can you over-breathe? That sounds a bit of a strange thing. I mean, I'm breathing now, but am I breathing? I'm breathing, in through my mouth and my nose and out through my mouth and my nose. I mean, what am I doing wrong? I'm breathing.
Right. That's right.
How can it be wrong?
Breathing, as many other physiological processes, they are very good described and established what the normality of this process is. And that's why we should address the normality first. The normality, how to describe the breathing. It's about volume.
Mm-hmm. Well, if I take a deep breath, I'm getting plenty of good oxygen into my lungs. I mean, this is good, isn't it?
The thing is that we need a certain amount of air in our lungs, but normally, but no more. It depends surely what kind of physical work you are doing, the level of this work, and so on and so on. But if you are in a normal, relaxed state, we can define what the normality is. And the normality is for a male, 75 kilos male of 45 years is defined in the physiological books. I remember it's like that. Is the volume of 6 liters in a minute. So we call it minute ventilation.
So I should breathe in and out 6 liters of air in a minute.
And it is defined as around from 10 to 12 breaths a minute.
Okay.
That's the and the amount of every breath is about half a liter. So if we take half a liter 12 times, we get 6 liters.
Mm-hmm.
So this is the normality. And we have to understand that the normality changes for each of us because of our age, because of our gender,
mm-hmm.
and because of our physiological data, different things. But that's normality. And what is happening when we are under prolonged stress, when we have a chronic stress, then we overbreathe. It means chronically. And to overbreathe, it means that we breathe more air.
So it also depends.
Situation. If for a given situation, it means that if we define normality for the normal position, like you and me when we are sitting and not working physically. So this normality would be around 6 liters. And if we are under stress, it would be 8 or 9 or 10 or 12.
What would it be like if, for example, I was suffering from cancer or diabetes? Would I breathe less or would I breathe more? What would be the demands?
You see, when we are ill, it's the same as being under stress because our immunity is working. Yeah. It has a hard time working and trying not only to defend, but to reverse the condition we are in. And that's hard work. So it's very taxing for the organism, for our body. And sure, we are under stress. So normally when people are ill, both with asthma and with cancer and with diabetes and with everything, all of kind of actually on normalbreathing.com. It's very, very, very informative site by Artur Rakimov.
Normal breathing. We just
normalbreathing.com, and he's my mentor.
Normalbreathing.com. I don't think this comes out in the replay, but we can just repeat that. Normalbreathing.com is the website.
That's right. Okay. You can see the norms, and you can see what happens when people are ill. The value of, not the value, but the amounts of hyperventilation in liters per minute.
Hyperventilation. Can you explain what?
Hyperventilation, it means breathing too much. So when we are sick and when we are chronically stressed, it's actually the same, because actually chronic hyperventilation is a condition. It's called CHVS.
Okay.
CHVS. Chronic hyperventilation syndrome.
Okay.
Chronic hyperventilation syndrome. It's the it's where we start overbreathing due to chronic stress. That's called chronic hyperventilation syndrome. That's the first thing that happens, and I can tell you is this syndrome in different stages. Actually, up to 85% of population of the Western world have chronic hyperventilation.
No,
different amounts.
That's incredible. But this hyperventilation, what effect does it have on the physiology? Because this must be a cause and effect thing that you can get into a bad spiral. Because from what you're saying, that chronic stress means that we're breathing too much, hyperventilating. But I mean, what can be the consequences on the body and the physiology of hyperventilation?
Very good question. Very good question. What happens when we hyperventilate? We change the balance, the equilibrium between two most important gases in our lungs.
Okay.
And in our blood too. And that is oxygen that we take from the air.
Mm-hmm.
Outside, and it's a carbon dioxide that we take from inside. It's a product of our metabolism inside of the body. So we get.
Okay, but it's a waste material, isn't it? We have to get rid of the carbon dioxide.
That's what we used to hear.
Okay.
That's a very big problem, because it's not only misinformation, it's also propaganda, and the propaganda. Both by medical profession and by many people working in health that don't understand what hyperventilation really is. And so they say to people, now take the lungs full of air, so much as you can to ventilate, to really get so much oxygen as possible in the blood.
What's wrong with that? But I mean, you wouldn't you? If you took in air, don't you? Isn't it a thing with the hemoglobin? It binds with the iron. That's why you have red blood cells. Isn't that a healthy thing?
That's right. That's how our system works. The molecules of oxygen, they bind to the iron, to the hemoglobin, to red blood cells in our body, and then they get transported. So yes, that's right. When we hyperventilate, when we fill the lungs full with air, we actually get more oxygen in the blood.
Okay.
But it's not interesting, actually.
Why?
You know why? Because what we really need is to get oxygen to the cells.
But isn't that a natural process? I mean,
That's not the same. And that's not the same. See, there's a very, very big difference. And that's why, as you see here, I post, it's called, in the message, it's called Bohr law.
Bohr.
Bohr. And Bohr, it's not Niels Bohr. That's the Bohr we know. It's a Danish scientist, physicist, that was working with the electron model, and with the energy. And very, very interesting guy. But it's actually about his father.
His father?
Really, not really known for a wider public, but he should. But because he's he's a fantastic capacity into physiology, human physiology. He in 1904, it's 110 years ago, more than 110 years ago, he understood the physiology of oxygenation on the cellular level.
Wow, we've ignored it.
That's right, and how it's dependent on the equilibrium, on the balance of gas in our lungs and in our blood. And he said that actually the more oxygen we have in the blood, the less oxygen we get to the cell.
That's strange. It's a paradox. Another paradox.
The more oxygen we have in the lungs,
yeah,
the less oxygen will come to the cell. And it's because of when we ventilate our lungs too much with oxygen from outside, because carbon dioxide in the outside world is at levels between 200 to 250 times less than in our body.
Wow.
Actually, what the hyperventilation really is about, it's not about to have more oxygen. It's actually when we hyperventilate, we remove too much carbon dioxide. And it's very easy thing to do, because in the outside air, it's from 200 to 250 times less carbon dioxide than in our body. So 2 big breaths or 3, it's actually enough to lower the amount of oxygen delivery to the cell.
Wow. So
that's why people, when they hyperventilate, it's known in some therapies when people start hyperventilate like that, and they start, looking and seeing and hearing different crazy things, and it's actually not because they get a lot of air in the cells. It's because of the effect of lower oxygenation of the brain. The brain starts actually working in a little bit crazy way. So that's that's because the lack of oxygenation on the cellular level, both in the brain, in the muscle, and in all the tissue.
Okay, but what I mean, you say the cells need oxygen. I guess that's fairly self-evident. But in relation to cancer, for example, what are the consequences of not getting oxygen into the cells? Why is that? Is there a connection with cancer?
That's a very good question, because what happens with cancer, and what happens with cancer is when, and with other diseases and conditions, the cells of our body, when they start lacking oxygen, and that's what they do when we have chronic hyperventilation syndrome, because of having stress in our lives all the time, and we have very different genetic code. Some genetic code, some of us, we have predisposition for cancer. In some of us, we have predisposition for asthma. Some of us, we have predisposition for diabetes or Alzheimer's, whatever. So what happens? We actually force the cells, force our genetic code to express itself. That's what it's called in genetics and in epigenetics too.
Okay, so we
force our genetic code, our DNA, to express our genetic code.
And it comes out as cancer.
It's not sleeping like it used to be, but we get a problem. We get some kind of illness or condition. And what happens particularly with cancer is that that the cells, the normal cells in the body, when they start lacking oxygen, they start start finding some alternative fuel sources.
Yeah. Okay. Like for example, yeast would in bread. I mean, they work off different things. So I should imagine sugar and fermentation has an influence here when there's no oxygen.
That's right. And because the stress also drives both sugar and insulin levels up. So there's a lot of process involved in this. But normally when we have stress, so we have very high sugar levels, glucose levels in the blood. Also because of wrong nutrition. Many of us have wrong nutrition that drives insulin levels, that actually drives glucose levels, and makes us less and less sensitive to insulin. Insulin sensitivity is going down, and that is perfect for cancer cells, because what happens is they use fermentation of glucose as a new alternative fuel source.
As I said, like yeast.
Cells, not the cancer cells, but normal cells. And they become cancers in this way. They become cancers. They mitochondrial metabolism. Mitochondrial, it's the place in the cells where the energy getting produced. ATP and all those things. So the metabolism, that's a wrong metabolism. That's the erroneous metabolism. And they slowly became, the normal functionality of the cell gets changed. So they become cancerous.
So you could say that it's a form of survival by the cells.
That's actually the form of survival by the cells, for sure. Yes. And when we deal with medicine-free processes, medicine-free healing, and what I do, I am not a healer. I'm not a doctor. I am just helping people to establish their own self-healing processes in their bodies. Mm-hmm. So what is crucial to understand is that it's the same process for all cancers.
All cancers, okay.
Yeah. I cannot say like 100%, but but what the modern science tells mostly that the cancers, that the cells become cancers, and they change the metabolism. That's the normal process for thriving of cancer.
Okay. Would you say then that that when people are stressed, therefore they're not breathing correctly, therefore they're not getting oxygenation of their cells, that they are almost in a precancerous state?
You can say that, yes. What happens is it's the the cells are mutating, and sometimes these mutating, and they are there's a lot of cell divisions going on, and when the cells become cancers, this normal process of normal division gets out of control. So the population of cancerous cells start growing, and start establishing kind of their own sites where they thrive, and they close themselves from the environment, so they can. So it's actually pretty hard to come and change the processes there. So we need to understand this, and we need to understand that in order to stop the cancer and to prevent the cancer, we need to change the environment by lifestyle change.
Okay.
And the part of it is a very, very big part of it. It's the change of automatical breathing patterns. And that's what we're actually talking about today.
Yes.
The Buteyko method for optimization of breathing, it's not just dealing with changing breathing right now where you are training. No, the very, very big difference from many other techniques are that there's a measurement routines built in Buteyko method of optimization of breathing that actually can show us that the automatical breathing patterns changes 24/7. That's
wow.
So also when we are not aware of our breathing changes.
Now you're mentioning this this method, Buteyko. It sounds Russian, Ukrainian, whatever. Can you give a bit of background, because the Buteyko method has been around for a while and it has been successfully used. I think so. This Irish guy, Patrick McKeon, does a wonderful video on how to cure asthma, completely cure people with asthma. Mm. Can you tell us a little bit about the history and Buteyko?
Well, Konstantin Buteyko, he discovered his method in 1952. I remember, and not because I remember I've been alive at that time, but as I remember, and he lived until 2003. So he actually practiced this method for 50 years of his life until his death. And he taught a lot of practitioners and medical doctors in Russia to help their patients to reverse the lifestyle disease. And mostly he started with asthma. He started with, mostly with asthma because the Russian medical establishment wouldn't let him make the cases on the hospital on other diseases.
I see. So, it was only asthma.
So the trials were only made with asthma, but he really wanted to make the trials on cardiovascular disease, on the most of cardiovascular disease actually, on diabetes, both 1 and 2, on so on a lot of
neurological diseases.
Neurological disease too, but he only made the trial on asthma, and that's that's a lot the same situation in our societies right now, where the medical establishment has their own ways, and they don't really want alternative techniques. And the word alternative is really crazy. It's defined in a totally wrong way. To cut people and to give radiation and different kind of acids that are poisonous and actually cancerogenic too. It's not alternative. And
no, but
they help people heal themselves by breathing and change the diet. It's called alternative.
It's funny, but we have a. I mean, this is a talk for another time, another subject.
We're going to talk about it. But what I will tell about Buteyko is, in 1953, he discovered that when the people, he was working as the assistant doctor in the hospice where people were dying, and he saw that the people that were closer and closer to the moment of death, they actually were hyperventilating more and more.
Wow.
So that's what he saw. And he started immediately thinking about the mechanics of breathing and the physiology of breathing, what it actually does. And his background is actually as a mechanic. He was working in the World War II before that, after the war, I think, as a mechanic. So as an engineer, he saw a little bit physiology, and he understood that there were actually laws defined, the Bohr's law, and in Russia it's called Verigo, Nikolai Verigo, and Christian Bohr's law, that according to this law, he really explained, because when people started to ventilate the lungs too much, they actually were closer and closer to death.
Oh.
Then he established a lab, and in the lab he started measuring the pH levels, the blood pH, and he started measuring the amount of carbon dioxide in the blood related to the ventilation levels and to the breathing patterns of sick people. And he found out there's a relationship between the the levels of ventilation, minute ventilation, and the what we call the atmospheric pressure of carbon dioxide in the alveoli, in the blood, and in the lungs. So he made a correlation, and he found out that if it is like that, then maybe it's possible to reverse the illness volitionally. Volitionally means by understanding and by willing, volitionally by a deliberate volitional reduction of ventilation volume. So he understood that our breathing muscle, the diaphragm, has a major impact. And he understood that decreasing the levels of relaxing the breathing muscles will actually help stop hyperventilation.
Okay, so consequently,
and he formulated the method of volitional reduction of hyperventilation, and actually of reversing the lifestyle disease by volitional reduction of hyperventilation. And he made the different kinds of exercise, and he made lots of scientific research and development in this area.
Okay,
it's actually patented.
Okay, wow. So what are the basic principles of Buteyko breathing? How does it work?
And the principle of Buteyko breathing can be explained actually in few words. If I really concentrate, then maybe I can do it. The first principle of Buteyko breathing is never breathe through the mouth.
Never, not even out.
Not even out, no.
So always breathe. What happens if you've got a blocked nose, though? I mean, many people get colds and blocked nose.
Yeah, but there's a lot of different exercises in Buteyko method to open up the nose.
Okay, understood.
There's a lot of different techniques.
So rule number one, breathe through the nose. Always.
Train always to breathe from the nose. And if you are making physical exercise, and you will right away think that, wow, this Misha Sakharov, this crazy Russian, what he says now, it is impossible. Because when I'm doing physical exercise, I always breathe through my mouth, and it's totally impossible for me to breathe through my nose.
True. I see all the runners running past the door here they run a half marathon twice a year, and they're all.
And that's what I say is, in order to retrain this, you have to understand that this is a very, very smooth. It has to be a very smooth process, and you have to understand the relaxation, and you have to actually change in a way from your way of thinking from goal-oriented to process-oriented, because we always thrive to approach and to reach some goals and targets, and that's what makes us actually hyperventilate, because when we're doing physical exercise, it's totally the same.
Yeah. Okay.
It's the same, because you see, we do it on time, and we do it on a number of kilometers or miles. We have to reach on a particular time, and that's a problem, because then we move from our senses to the head, that we are thinking about our tasks and goals. But what we really need, we need not to cross this threshold when we open the mouth. So when it's too much strain for our, misaligned breathing patterns, misadjusted breathing patterns, when it's getting too much, we are forced to open the mouth, and we take it as a normal thing.
It's a normal thing.
It is not.
Working.
It's not normal. It is not normal.
But when we breathe, say breathing through the nose, that's one thing. But what about if you're running, you tend to have your air up here, you're breathing with your chest, and everyone says you breathe in, deep breath, expand your chest.
That's how you train, definitely, because there's a different levels of exercise. And yes, in some very, very hard levels of exercise, you start breathing with your chest, and it's okay actually, because on this level of exercise, you are making a lot of carbon dioxide.
Okay, but and you have to get rid of some. But what about when you're at rest? I mean, how should you actually breathe? You're breathing through your nose. This is right. So your mouth is closed, breathing through your nose. But where are you breathing? How are you breathing there?
When I'm in relaxed situation,
yeah.
I'm breathing by relaxing my diaphragm muscle and
your diaphragm.
The belly muscles.
Your belly muscles.
Yes, the belly
muscles. They're a long way from the lungs. The lungs are here.
You see, the belly muscles, they are around the diaphragm muscle. The diaphragm muscle, it's we have lungs here.
Yeah.
And then we have lungs here, and then we have a diaphragm. And the diaphragm is the muscle that that the lungs are established on, lie on. So it's under. So when the diaphragm muscles do this movement, so it expands the lungs, and we get a low pressure in the lungs, and the air from outside is getting sucked into the lungs. Okay, and that's work. But when we relax the muscles, then the air slips out of the airways.
So you're not taking like a big breath up here. You're just moving your muscles down here.
That's the normal breathing. The normal breathing is when we are working only on inhale. It has to be understood that as all the mechanism in our body, there's a perfect balance, and have to be a balance between work and relaxation. The most vital of all processes has to be well established and working. So it has to be balanced. And that is defined as normality. The breath in is work. The out breath, the exhale, is not work, is relaxation.
Okay. But are you saying then that we have to, you say changing the breathing. And normally, I mean, when we're asleep, we have this autonomous system, we're breathing. Yeah. But, how do you do this so it becomes automatic? I mean, what are we doing with this training to make it into an automatic process?
Okay. What we do, that's a very good question, Steve. Thank you very much. That's a very good question, because what we do, how can we change automatical breathing patterns 24/7? That's a very good question.
Yeah, how
are they being changed? Because it's not simply, but our breathing patterns are controlled by a breathing organ that lies in our brain, and it's called medulla oblongata. And medulla oblongata regulates the breathing according to the levels of the different gases in the blood. And gases in the blood are fluids, most of them. So gases in the blood are fluids. So there's some cells that are called chemoreceptor cells. And these chemoreceptor cells, we have different cells for every kind of substance it is measuring. So if you see chemoreceptors at the small measurement devices that lies in your bloodstream, then you can say that they communicate with the brain, and they are telling which levels of gases you have in the blood. So that's how medulla oblongata controls the breathing. When the levels of carbon dioxide are getting high, according to this state of health you have, it means that you can tolerate only a small amount of carbon dioxide. And if you have a state of ill health, then your level, if you say that's the level of oxygen in the lungs, the normal level, and that's the level of carbon dioxide in the lungs. So when you have a state of ill health, your level of oxygen in the lungs will go up. You're hyperventilating, you're stressed. But because we only have 100%, then something has to go down. And that's the carbon dioxide. And when your physiology is getting habituated to this situation, Then medulla oblongata, the brain center. That's what gets habituated. That becomes a normal level. The wrong level becomes a normal level because you hyperventilate chronically. And what it is, it's your automatical breathing patterns are controlled by automatically related to this low level. When we do breathing retraining, we habituate medulla oblongata to higher levels of carbon dioxide, not the levels where the illness starts and proliferates, but the new levels, which are corresponding to the normality from the physiological textbooks. And this normality is defined as 6.5%.
6.5%? That's crazy. It's only 4 per mil in the atmosphere. That's 6.5%.
6.5%. And what it is, it was a level defined in physiological textbooks for 100 years ago. Now it is actually defined as 5.5%.
Oh,
and you have to know that we can only live until the level of carbon dioxide is about 3%. So when it goes down, when the illness, the medical condition that we might have, it goes worse and worse. So the level of carbon dioxide, we hyperventilate more and more, and the level of carbon dioxide is reaching the 3 and we die. So when it's reaching 3, then we die. And that's what Buteyko actually saw. And that is very really interesting to understand the history of the method. How Buteyko himself, he got this inspiration, if you can say.
And this is all on the normalbreathing.com. We can read about this, yes?
You can read about this.
And also on your own website, yes?
Yeah,
Sakharov.com.
Sakharov.com.
Yeah, I recommend everyone to subscribe to Misha's blog. It's all very interesting stuff. Sakharov.com.
Okay. That's what is interesting, is that by exercise defined by Dr. Buteyko, and actually there's a lot of exercise taking further, and there's a lot of practitioners around the world, and I'm one of them. What happens that by exercise we temporarily heighten the level of carbon dioxide, but if we do it often enough, then our medulla oblongata gets reprogrammed to take these new, a little bit higher levels of carbon dioxide as the new normal.
Okay. But Misha,
what happens?
Okay, but Misha, what you're talking about here is a very scientific, obviously being studied process. Don't we need some special measuring equipment to measure the amount of carbon dioxide? I mean, how do we know that we're going in the right direction without some special measuring equipment to measure the carbon dioxide?
That's very good question again, Steve.
Oh, thank you.
Oh, guys, he's a very good interview. Okay, Steve, you are totally right, and that's the right question. And no, you don't need special measuring device, because that's one of the forces of Buteyko method, that there's a built-in measuring procedures and measuring routines that are, correlated with this table of health that I've been talking about, where we have both pulse, level of carbon dioxide, the level of hyperventilation. It means the values of minute ventilation. And they all are connected by a measuring of what Buteyko called control pause.
Control pause. Okay.
And the good thing is, to measure control pause, you don't need any devices. And that's the amazing fact, actually. The most people, when I'm talking about it, they're amazed. Can you really measure the level of carbon dioxide in your arterial blood without any devices? So yes, because Buteyko found out by practice that there are at least 2 physiological reflexes in our body.
Yeah.
That if we measure in seconds these physiological reflexes, they will be correlated to all of this data in the health table. And
wow.
it's called control pause. The control pause can be explained as following. It's the number of seconds.
Number of seconds, yes.
Yeah. From the breathing stop.
Mm-hmm. When you breathe out, yeah.
Yes, in the state of normal state, I mean in the state of when you are not working, when you are breathing normally, relaxed state. So the number of seconds when you after you stop breathing, after a normal exhale,
mm-hmm.
in the relaxed state.
So
you see, you've been sitting for 3 minutes, relaxing, and then you look at your breathing patterns. Inhale.
You need a stopwatch or something.
Inhale, exhale. You need stopwatch. That's right. And
most people have it on their phone.
That's right. You can do this. So when you exhale, at the end of the exhale, you stop breathing, and you are listening to your body signals. So what your body is telling you, and what your body is going to tell you is there is two physiological reflexes. The first reflex is the first movement of the diaphragm muscle, and we can sense it as the little push in this region, a little push, and we have to actually train to be able to sense it at the right time. It takes some weeks to really measure control pulse in the right way. You have to be supervised by a specialist. But another physiological reflex is the reflex of swallowing. So you measure amount of seconds until one of those reflexes.
I see.
That's physiological reflexes. But the third thing you can measure until, but it takes really training, is the first desire to breathe.
Okay.
Actually, that's the most correct measurement will be until the first desire to breathe. That when Pino Oblongata tells your breathing muscle for the first time, move.
Okay, so like a normal person who is hyperventilating, has this hyperventilation syndrome, yeah. In your experience, what is the norm? Is it 10 seconds, 20 seconds, 30, 40? What is the norm for someone who's untrained and has this?
It's very different. But as I said, 400 years ago, the norm was connected to this level of carbon dioxide of 6.5%, and it was 60 seconds. That's
60 seconds. Yeah. Okay.
Now the new norms from physiological textbooks, they're saying 40 seconds, and 40 seconds relates is related to 5.5% carbon dioxide in the blood. So, but that's normality for now, for 2015. But you see, when I'm working with my clients, I still work after the old measures.
No, I see.
Yeah. But what I see in my practice is that the most of the people have almost a half of normal.
So 20 seconds would be normal.
5 seconds.
Well, maybe people watching this on the replay, people should try it. You breathe out, hold your nose, and see when the reflex is to breathe, and then count it on the thing and see how long it is. And then you get a pretty good idea of your general state of health from this test. And you say that the Buteyko said that observing cancer patients, he found that they were hyperventilating very much. So a typical cancer patient with a fairly advanced state of cancer, how many seconds would they be?
Well, normally the people with cancer that start at my place working with me, they have between 5 and 10.
Wow.
Yeah.
So it's a pretty good measure.
Around 3.5% of carbon dioxide in the blood. And as you remember, I said that 3%, that the threshold that the life cannot be sustained because there's too little carbon dioxide in the blood, and according to the Bohr's law, the affinity between the molecules of of oxygen and hemoglobin is getting too big. So when the carbon dioxide is too low, the affinity is so big that
you can't release
the hemoglobin would not slip the molecule of oxygen towards the cell, and the cell will starve to death, actually. What happens?
Wow. So what about this? So that's on that side, on the very low side. But in your experience, I mean, you've got a lot of experience. I know that you monitor your clients very closely using a computer model that you have developed. So at what level of CP, in your opinion, do you have to get before cancer starts receding and maybe you become cancer-free? What is in your opinion?
Buteyko defined this of being 60 seconds. In his writings, in his lectures, it was said that the cancer will stop when it is in 60 seconds.
And is that your experience? Your own experience?
Actually not.
Okay.
Because I see that it takes more to, when we come to the 60 seconds, then it depends on the how long time did you have cancer and what type of cancer you have. I see, because I work with cancer clients that are terminal and that have the worst cancerous tumors, as a glioblastoma, for example, and astrocytoma, that are deadly, that are considered being deadly and not curable. I see that we need to go way over 60. And for some cancer types, it could be enough with 60. But anyway, what I see is that, especially with very aggressive cancer types, you have to work and work and work also after 60. That's why this work with cancer patients, it's very, very interesting. And I love my job, but it's hard because you see, it's not actually about the physiology. It's not about human physiology. It's most of all about the if we can call it, the mechanics of and physiology of the process. So the most important thing, and something we cannot do it without, it's to build a process. And that's why we work a lot with mental training, with physiological mental training, with active relaxation in movement. We are working with a model where our awareness is building up in the model of thinking, feeling, and sensing. And this model we're working with all the time. And we're working something, the idea is that we have to be in the sensing mode all the time to avoid the fear of death. For the people with cancer, the fear of death is one of the major drivers of their hormones, actually,
wow.
Of enzyme levels, of hormones, everything. And if we don't work with this, we cannot combat the cancer.
I see.
The acidity in the tissue, the levels of glucose, the sensitivity, the hemoglobin sensitivity, all of these things, they are related to the level of stress hormones in the body.
Wow.
So, and is not enough for actually we have to go further. And there's some blood cancers, as leukemia. We can see that the process is very, very slow. And if we can see the tumor, shrink, then to let the leukocyte count, like for example in leukemia, fall, you have to drive your CP very, very high, and you have to make a lot of vigorous physical exercise from the start, not vigorous, just movement. But it can take a half a year, it can take 9 months, it can take 1 year. But normally we can see a change in our health already in 1 month.
Mm-hmm. Okay.
Then it becomes better and better to work with the mental side, because you can see the process.
Okay, Misha, I believe in living a healthy lifestyle and doing the right things will prevent one from being affected by these lifestyle diseases. And I wouldn't say so far so good with me, but I'm sure, I hope that people are watching this, people who are watching it who do suffer from a lifestyle disease or are suffering from cancer, I hope this is very useful to them. But of course, the great majority of the people will not be suffering from cancer. So would you recommend that people take up, among other things, Buteyko breathing exercises to create a sort of a healthy physiology? And secondly, what would you reckon? What would be the aim? What would be the CP that you would recommend people to aim for?
It's a very good question again, Steve. Thank you very much. And what is crucial to understand, that the breathing is the first line of life support in us. So when we optimizing the breathing, we're actually normalizing all metabolic processes in the body. And we have 12, 13.
Wow, it has that much influence, yes,
in the body, that are interconnected and interdependent, and they all are tubular, and they in different ways. So they are all of them are being normalized when we change the normality of carbon dioxide and oxygen ratio in our body. All of these interconnected 12, 13, sometimes people say 12, sometimes say 13 body systems that are interconnected, interdependent. They all is getting normalized. And what I will say, already, if you have, for example, diabetes or asthma, already when you get up to 25, CP25, you will see that the amount of symptoms are falling drastically. And if you get to 35, then the most of the symptoms of asthma and diabetes too, and many other lifestyle diseases will simply go away.
That's incredible.
And the conditions, the illnesses will reverse, at least reverse.
Okay, so there's a direct connection between the breathing, method of breathing, and our metabolic systems, and all these diseases, which really are the body's reaction to a fault or a failure within the metabolic system. That's basically it. As to sum it up. Well, listen, Misha, we've been on for an hour. I think there's plenty for people to digest and think about with this. So I think we'll wind it up there, if it's okay with you, if we've covered most of the points. It's fascinating. And of course, Misha, this is one of the tools, but I think one of the major tools in his toolbox, as it were. The others being, well, we've discussed these before, is the ketogenic diet, the IR, the calorie restriction, the intermittent fasting, so the IF, and the centering, and the mental processes. So we've still got plenty more to speak about, but I think Misha will be putting this up. I see someone's just joined us. You have to look at the replay. We will be posting this to YouTube as soon as we can.
Today, yes.
So which is your YouTube name?
The channel is called Breathing for Living.
Breathing for Living. Breathing for Living.
For Living.
Yes.
By Misha Sakharov.
By Misha Sakharov. And don't forget, he's got a blog, sakharov.com, where he shows the evidence of what he's done so far. You know, as I say, people, when I explain to people what you do, they say they can't believe it. But you know, you're an engineer. You document everything you've done and everything. Well, the fact is that some doctors and professors in the field are taking notice, and they're very interested in Misha's work. So at least someone's listened, someone believes it, which is fantastic. So Misha, we'll sign off there. Thank you very, very much. It's been an absolute pleasure. I always learn something when I speak to you. It's amazing. It's like being at university.
Thank you very much, Steve. It's very, very kind of you. And you know what? I'm learning a lot talking with you too.
Okay. Thank you then. And thanks for our viewers.
Very inspiring. And thank you guys for joining. Big kisses from here, and connect with us, both with Misha and with Steve. And we're going to follow with many, many blabs. At least twice a week. Is that right, Steve?
Yeah, we can do it twice a week. Yeah. Good. Okay.
Kisses.